greatest mental health crisis that we have ever seen. And before it gets better, we'll see it get worse. These opportunities that we have today, sitting in these forums, providing this information, educating the community and our stakeholders, this is a way that we can help to, like I said, minimize those stigmas and making sure that we address all possible situations and don't minimize them.
I would say I am a former student athlete. I played Division I football at Vanderbilt University, and I have experience in good leadership and good coaches that you could turn to for situations like that. And so, like Mr. Taylor said earlier, I think when we ask the right questions, when we start to ask those questions, why don't your student athletes feel safe going to the coaches? Because we put a lot of emphasis and responsibility on our young people when we gotta look at the adults that are leading them. Why are they not safe people to go to about certain things? I play for James Franklin, who's a head coach at Penn State. And one thing that he would do was model the behavior, right? Modeling the behavior of being vulnerable in front of us, no matter if it was in front of a team or in front of TV cameras or whatever. And he would show emotion. It was okay for a grown black man leading a football team to cry. So I know it's okay for me to do that as well. And so I think when we look at, when we have to ask that question, why are the coaches not safe? And there are an organization that I love, it's Nashville Coaching Coalition, that works with coaches that help them see past wins and losses, see past the stats, and really get to the human aspect that is the student athlete. And I think that is a huge component to it all. And then I think, again, just in modeling it, showing what just difficult conversations look like, whether it's we are going to have a peer-to-peer conversation and student athletes are around, we can see that we can have conflict and resolve that conflict without anger, without fighting, without other solutions that we've been taught. And so I think mimicking that behavior and being a safe place where they can turn to is crucial. Or modeling that behavior, so I say
Black and brown students' abilities to overcome barriers.
So I'm not a counselor, but I, just as someone who is Hispanic and just my lived experience and what I see in my community and also in Black communities, it's like everything that existed prior to the pandemic was exacerbated. So the systemic racism, the inaccessibility to transportation or to healthcare access didn't go away or stay the same, it got worse. And so let's look at the digital gap. Black and brown households had a greater difficulty accessing higher internet, and that's a huge problem if the education model went to virtual learning. So I would say it was a recipe of really just intensifying existing systemic inequities, and we endured the worst of the pandemic in my opinion.
Yeah, I think we did. I think the numbers show that. We endured it from a physical health standpoint and being impacted by the result of being impacted by the pandemic, but also from a mental aspect. And COVID, it was a thing that I think touched some of the greatest fears that we face as human beings. Right? We had to deal with uncertainty. We had to deal with isolation. Those are great fears for humans. To not know what's on the other side of that. That's where all of religion and faith and all these things come from, because we're trying to answer what happens after all of this. Right? It's a terrifying thing for us. And so it heightened that. We didn't know if we went to the grocery store, if it was going to result in us being sick, someone that we knew being sick. People lost a lot of lives. So grief and that tragedy struck us all, and it continues to. Like last night, I saw one of my middle school friends, and he just posted, his mom just passed away from COVID. Like, it's still affecting people. And then that fear of, not even fear, but just being isolated. Isolation, and they say, prolonged loneliness is equivalent to having 15 cigarettes a day on your health. People were experiencing this deep, deep loneliness throughout this, and we get impacted worse when it comes to those crises, because we don't have always have the access we don't always have the ability to go get the treatment and support that we need, and so greatly impacted by that.
That is definitely right. With COVID, those things, we had things that were happening prior to COVID, like President Hampton mentioned. And post-COVID, we have seen an increase in just those things coming to light that people were already struggling with. Our children were abruptly snatched from their environments, most of them safe spaces, because for many of our children, schools are the safest places for them. They were abruptly removed from those environments, not able to say those goodbyes, not able to do those normal things that they had been doing. And so their norm was disrupted, and there was no way for those, for many of them, for those situations and challenges to be addressed. And then we also have parents, let's not forget parents, who have unresolved challenges and not knowing what to do with themselves. And if I'm not able to cope with my own personal challenges, then what am I going to do about a child who's struggling emotionally and mentally? And we've had a subliminal rug where things are just being swept under that rug, and now what we're finding ourselves doing is tripping over that rug. And so if we don't continue to have these conversations and educate our community, it is definitely going to get worse.
Okay. Our fourth question is, this is from a student's perspective. As a student, what can I do to help my friends who are struggling?
So I really like this question because I started college in 2009, so I'm very removed at this point, but I wish I had this type of awareness and discussions. I'm sure they were there, but I did not have that interest and that initiative to really work on my mental health. So my college years were very challenging. There's a lot of things that I struggled with, and I wish that maybe my friends at the time could have asked some questions like, hey, I noticed you're blacking out when you're drinking. I noticed you're getting into fights and things like that. And they didn't, and that's okay because they were just trying to do the best they could for themselves. They're young too. And so I would say for those students that might notice something, and if it's too much for you to maybe approach your friend, then lean on counseling services on your campus. Lean on, I know Mr. Taylor mentioned like Headspace and all these different apps that are available that can also equip you. And when it comes to yourself, be curious. So I really encourage people to be very compassionately curious about themselves. So, I struggled with drinking when I was in college. So instead of asking myself, why do you keep doing this? Why do you keep messing up? I wish I would have asked myself, what is behind the drinking? Why do you keep doing it? And kind of like what Mr. Taylor said, that trauma that we experience prior to college will only be compounded by the stress of college and new environment. I mean, everything is so new, so much stress to perform, and of course the different pressures of maybe your first time being around alcohol, your first time dating, and things like that. So I would definitely encourage you to be curious about yourself and as well as your friend, and set boundaries. So like I said, if it's too much maybe for you to, because it's not your role to diagnose them or treat them. It's just, if you see something, say something, do something, reach out to someone that is trained. But that's truly being a friend, is if you really love and ride for somebody, you're gonna say something and you're gonna be there for them.
I was just going to say that in the college years, once you start college, that's a very pivotal transitional period, and there are going to be challenges and changes. You're adapting, like you said, to the new environment. You're adapting to the responsibilities of going from a child to an adult. Your responsibilities change. You don't have anybody there giving you step by step what it is that you need to do, but you are responsible for yourselves. And I would say one thing that I found as a college student and even in graduate school, I looked at the people who were trying to do it alone, knowing that we don't have to do it alone. We don't have to life alone. Even as graduate students, I oftentimes will tell our classmates, we never communicated. Nobody worked together, no one studied together. Everybody was just pretty much out there on their own. And so that's a transition period as well. And as adults, running households, raising children, tending to marriages and jobs and other responsibilities, we don't have to do these things alone. And I think that's what we need to be mindful of as well, and especially with our young people. You don't have to do it alone. So always have your support system. Get a network of peers and professionals, your teachers, to help you and guide you through your journey.
I'm going to piggyback right off of that. Best Colleges did a report and showed who do people feel safe and comforted by, who are those first people they go to, and it's their peers, it's other students. And so 65% say their other peers, followed by 56% go to their parents. And so with that knowledge, right, creating peer-to-peer groups, right, affinity groups, whatever, if it's BIPOC, LGBTQ affinity groups, where we talk and we're vulnerable about the conversations that we don't have out there in the world. We feel safe in this group. You can't come to this group if you're not going to keep it a safe place, right? Because everybody needs to feel that and be comforted in that way. I remember whoever asked this question, the fact that you're asking it is a fantastic thing. It shows your awareness around mental health and around the compassion that you have for your friends. And then if your friends are showing that they are struggling, it shows that that may be their screaming out for help. And so I think that's a good combination to then go to that next step and then providing resources. Again, I always say modeling behavior is so much better than telling somebody something. I can tell you go to therapy, but if I get up and go to therapy myself, and then you see the impacts that it's having on me, that may change something in you. First time I went to therapy was in 2019, and I went, and I was telling everybody about it, because at that point, the shame that I had around going to therapy had dropped to a level where it didn't exist. I wouldn't say it didn't exist, but it was lower. And so I was okay with telling people I was going to therapy. A year later, my best friend walking into therapy. I didn't tell him, I didn't force him, I didn't do anything like that. But I say going back to my college days, I struggled, but I didn't show it. And so like the friend that you can see that showing it, again, I think that's a good recipe, but I bottled mine up, I compartmentalized. Mr. Taylor talked about adverse childhood experiences. I came to college with all 10 of them. I checked the box on all 10 of them. And my coping mechanisms were to drown myself in the work, to do all these other different things that, distracted me from internal issues that I was dealing with. And so I think, if you can recognize it, that's a great thing. But sometimes what is mental health shows up and we call it behavior. Dude just snaps for no reason. He liked to fight. He doesn't. Let's look at the human in us all. No one wants to live in a brain that is constantly vigilant and wanting to be that person that lashes out. So when you see those things, that may not necessarily look like mental health. We call it behavior, we call it personality, but maybe we start to get curious around that.
I want to say something else regarding that. I think it's important to remember also, he mentioned being an example, not telling his friend what steps to take, but being an example and his friend watching him and then seeking those supports out for himself. And we have to always remember that each of us has had our share of experiences, and our culture dictates how we're going to address an issue, if we're going to address it, if we deem it necessary to seek support. What have been the examples that we've had in the household? How did we see challenges being addressed that our families face? Was it, we don't talk our business outside of the house? We hear that a lot. You don't talk about what goes on in the house. So culture will shape where we will go for help, if we'll seek those supports, if we think talking to a therapist is sharing our business or something like that. We have to be able to lead by example, and understanding that we can't force people to do things, but we can be the example and encourage them to get those supports. So I'm glad that you were there to show him how to do that by being an example and not being forceful, and understanding that if I walk the walk, then someone is watching me and people will follow your example.
Okay. Our next question is, what are the most current data trends saying about college mental health, especially in our BIPOC and LGBTQIA communities?
You got it. Close. So yes, I did look into data, and it wasn't looking good. I mean, it pretty much reflects what we've talked about so far. So the cultural barriers, the systemic barriers, and if you look at even with COVID, Black and brown people were more likely to get affected by it, contract it, and also died from it. And so we are faced with higher rates of, I know, like for Latinas, suicide ideation and suicide behavior is definitely a huge problem. Eating disorders, and we're not typically the face of those issues, and that needs to change. So I'm really thankful for this space where I see Black and brown, and we're talking about exactly what happens in the households and in our lives. So in short, the statistics, the data show that we need a lot of support, and this is a huge step in that direction.
There has been a tremendous increase in, of course, anxiety and depression and even PTSD. And so when we go through COVID, that is a traumatic experience for nearly everyone in our society. And our young people, our young Black and brown people, BIPOC, and then also the LGBTQ community has experienced that trauma along, in addition to, increased screen time. Like screen time has increased significantly, and with that comes the cyberbullying, comes the racist comments that you see throughout. Go to any comment section. It's the worst place to be in America, in the world, is the comment section of Twitter, Instagram, YouTube. Anytime I post anything about being a Black man, I know it's coming. I have to prepare myself for that, but why? Why should I have to prepare myself for that? And so with that trauma that comes even lower levels of self-esteem, greater levels of shame, greater levels of grief, grieving self, and those are impacting us significantly, young Black and brown LGBTQ people. And then to see what responses happen around that, what support in the systems. I'll be honest, like the people who talked about loving me, cared for me, and then were experiencing these same comments that I would get and see the things that I would see, talk about. I wrote a book called Perseverance Through Severe Dysfunction, Breaking the Curse of Intergenerational Trauma as a Black Man in America. And so it's one part mental health, one part social justice. And sharing that social justice piece attracted a lot of hate from a certain set of people. But the people who said they loved and cared and supported me, who were in that group, didn't speak up. Didn't say, I am a supporter, I am an ally. Just watch. And maybe they were, they just didn't have the words to say that, but you gotta say it. You gotta step up. We have to see the support and the allyship. It can't just be when it's one-on-one. I need it to be public. And so, yeah, you have increased hopelessness. We got people who are seeing doomsday every time they get on their phone or look at the TV. And that's not reflective of the actual world, but that's reflective of what media shows us. It gets the views, it gets the clicks, and these are what our children are seeing, our young people are seeing. And so I think one of the great things, this might be one of the later questions, but like digital detoxes are so important. To put the phone down, to get away from the screens, to be out in nature and connect with nature is huge to start to combat some of those trends that we've been seeing.
We're talking about creating safe campuses. We're talking about real challenges and issues that impact our students. I have a trans daughter whom I love with every ounce of my being. My child attended an HBCU, and she was on a campus where she was not safe. And you mentioned, why do I have to make the adjustments? What protocols are in place to create those safe spaces for those students? We don't govern and dictate necessarily the students that we take into our schools. Our responsibility is to manage the people who come on our campuses, the students who are enrolled in our colleges, to create those safe spaces, to have those, why should a trans girl be in a dorm with boys? Do you understand what I'm saying? We have to have those conversations, and we can't be afraid to step up and say those things. Everybody's not going to be in agreement, and no one's asking you to agree. But we are asking that we create those safe spaces, allow for them to have places to have those conversations with students like themselves, and to be safe in their living environment, on the campus, in the classrooms, free from harassment, free from the agitation. And that's where a lot of our mental health issues are coming from too. A student should not make attempts on their life or die by suicide because I'm not accepted, or because I'm being picked on, or I'm not safe at school, or I'm not safe in the classroom, I'm afraid to go take showers, things of that nature. And so we have to have these conversations. And as I look out across the room, I see a lot of people sitting in here, but I don't see a lot of students. And that's who it's impacting. And we're having these conversations, and we're educating the community so that our students can have safe spaces. And we have to be able to continue to do that and not be afraid to speak up and say those things.
Okay. Our next question is, as a counseling intern, what tips or tools can you share about crisis interventions and useful strategies that you wish you would have applied just starting out?
Do you want me to take that? Yeah.
As a counseling intern, what tips or tools can you share about crisis interventions and useful strategies that you wish you would have applied just starting out?
I'll say the counseling profession is full of knowledge, so much information. Don't think you're going to come out being able to apply everything immediately. It takes time to learn. And it also depends on the situations. So you have to learn to assess situations and what it is that you're dealing with when you have a challenge with a client. Be patient with yourself. Continue the education even after you graduate from school. Continue taking classes, and educating yourself. And don't think you're just going to come out knowing everything and doing everything. It is really, truly trial and error, which is why we have to work under a clinical supervisor, and you have to obtain so many hours working with someone who's licensed, and you're not able to work on your own because you have to be matured and educated in that area. So I would say give yourself some grace and learn as much as you can and work very closely with your clinical supervisor.
So I, as I mentioned, I'm not a counselor, but as a life coach and really as someone who has seen multiple therapists, psychiatrists over the years, some tips that I'd like to share for novice counselors is, one, practice boundaries. So take care of yourself. You're not immune to the pandemic or to your own family trauma, your own relationship dynamics, and so make space for yourself, hold space for you, whether it's you contacting a therapist and having your own therapist or your own support group, but just make sure that you take time. I know for myself, so I focus a lot on mindset and trauma recovery, so often my clients disclose trauma. We have some pretty emotionally charged discussions, and I find myself really sleepy. And I'm like, okay, that's a signal that I need to do something to decompress after a session for myself, whether it's play with my dog or go and watch a YouTube video. And then the second piece of advice would be to do a personal inventory of your own. It's similar to the first one, but your own traumas, your own relationships, basically have a hold on your own baggage. I've had, as a patient, therapists disclose things and offer unwanted opinions and biases about their own experiences that were actually pretty harmful for me. So please make sure that, let's say you're a survivor of domestic violence and your client is currently going through that. Check yourself. You're not talking to you in that position, you're talking to someone else. They have their own views, they have their own autonomy. Maybe they choose to stay. That's for you not to make that decision for them, but to support them, provide that safe space. So again, hold space for yourself, and then also keep your own emotional and experiential baggage in check.
In the theme of Mr. Taylor's talk, I'm going to say we are better together, right? So if crisis comes up, know that you can lean on your supervisor or other people around you, other counselors. It's not solely up to you to solve the problem. You have a team, you have a support group, you have systems in place to help you deal with those things. And I would say trust your training, trust yourself. I think early on in careers, we have imposter syndrome. Even later on in careers, that probably comes up, and you overthink things that you are prepared for. You are prepared for dealing with crises if that is the work that you're going into. Trust the training. And there was one more point I had. Oh yeah, it was similar to the boundaries that Priscilla talked about. I like process, and I like to have, when I'm starting to feel dysregulated, what am I going to do after that session? Right? I'm going to light a candle with a wooden wick because I love the way it smells and sounds. And I'm getting to these senses, right? I want to go grab a warm cup of tea. Now I got to feel and taste. And coming back to those senses so I can bring myself back to the present, because if you're dealing with a situation, and I'm not a counselor, y'all, but if you're dealing with a real situation, you're probably going to be stuck in that past. Even if the past was 5 minutes ago, 5 days ago, you're going to be thinking because you care. You can get into this profession if you didn't care. And so how can you, in a form of creating boundaries and have self-care, come back to the present and recognize that that person does have their autonomy? And at the end of the day, they are responsible for their lives. You can provide your resources, your knowledge, your expertise. But I've been a friend to, a counselor, a somewhat counselor to, a mentor to people who have died by suicide. And I could carry that weight. But at the end of the day, people die by mental illnesses, just like they die by physical illnesses. And I can't carry that, so I have to find ways to compartmentalize, which can be healthy to an extent. How do I compartmentalize? Yes.
I was just going to say, when Priscilla referenced the boundaries, and understanding that even when we seek professional support, in counseling we refer to it as transference and countertransference. And when we have our own challenges and issues, when she said, make sure you check yourself, because in the church, we call it bleeding on the people. In counseling, it's transference and countertransference. And so you want to make sure that you don't become so enthralled in what the client is sharing, and you forget that you're there for them and they're not there for you. And that's very important, and that's why we have to have our own emotions and challenges in check, so that we don't overshare or have them thinking that they're there for me, and they leave and they're like, well, I went in there for this, but I ended up helping her, So we do have to be careful with that.
Okay, that leads us to our last question. What advice do you have for clinical mental health interns when it comes to self-care and tactics supporting to yourselves?
I see you kind of touched on that, but I'm a huge advocate for self-care. Before you pour into someone else, make sure that your cup is not only full, but overflowing. And with that surplus, use that surplus to pour into other people. Because you can't give from vapors. You can't give if you're, this is coming from someone who I really had to learn this. Speaking of culture, in my culture, being Latina, I don't want to say groomed, that's a little too intense, but we're raised to be very self-sacrificing and very of service. And so I remember in college, I remember one time passing out, and I was just so stressed, but I still, all right, gotta go to class, gotta do homework, it's like nothing happened. And so I really did not know what self-care was until probably I graduated law school, so probably late 20s. That's maybe when I started to really prioritize myself. And so I can't imagine, as a counseling intern and in that space, you're constantly confronted with your own traumas, because I'm sure it's going to come out in courses and assignments and things and in sessions. So please, every day, literally, if you have to block out a time in your Google Calendar, have that for self-care and really take it seriously. And nobody can mess with your self-care time. So it's like, I'm not taking appointments during this time. I'm not taking calls. This is just me time to decompress. I know Reggie mentioned different sensory methods to do that. I like to scroll on Reddit. I like to go on walks. I'm a big proponent of affordable self-care, because I know when we hop on Instagram and TikTok, it's like, oh, do a bubble bath or go to the spa. Nobody has time for that when you have a lot going on. But we do have time for meditation. We do have time for whatever your self-language is. I know Mr. Taylor mentioned his daughter's is gift giving. So mine is act of service, unsurprisingly. And so to show that to myself, I might do things like make my bed or make myself a nutritious meal instead of skipping one because I'm so busy. So really tap into whatever your love language is and apply it to yourself.
I think I mentioned, some earlier when decompressing between session, but I think most of my work has been in the finance space, and I think often when we are experts at something, we neglect seeking other experts in those things. So continue. If you don't have a regular therapy session or a regular therapist, find one. You're gonna need it. And utilize that throughout your entire career, because that is going to be the way that you care for yourself when you are taking on and having so much compassion fatigue around the people that you are caring for. So find that regular person or people that you can lean on, even though you have the expertise. And one thing that I always come back to is just a mantra that I say to myself. Self-care is sacred, not selfish. Self-care is sacred. And so it is a non-negotiable for me. Now, if this moment is dedicated, I got blocks in my calendar where it says my time. And my time is not interrupted by anybody else. If I choose to spend my time with someone else, then that's my choice, but my time is my time. And so recognize that it is sacred and that you must hold that dearly. And that has to be a huge boundary for you so that you can be the best version of you that you want to show up to for your clients, for your family, for your life. Patience. I'm in financial.
I would like to say, when it comes to self-care, one of the key things is setting boundaries, respecting those boundaries yourself, and then enforcing those boundaries when it comes to other people. In doing so, you teach people how to treat you. I would also piggyback on what he said about making sure that you have someone as well that you can go to and refer to. And because I have such a tender heart and I'm so compassionate, I had to literally pray about it because I didn't want the things that were coming to me to bog me down. and then I not be able to function in the capacity that I needed to once I left those people that I'm called to help. And so I lead by being concerned and not consumed. And that means that what you bring to me, you bring it to me, but I have somewhere that I take it so that I don't carry it away with me. So set those boundaries and those expectations. Respect your own boundaries, enforce them with other people, and learn and live by being concerned but not consumed.
Okay?
Can I add a little bit more to that? I had a therapy. I went into a therapy session one time last year, and I was dysregulated, to put it lightly, but I was pissed off. I was upset. I was triggered, and I did not want to be there. I probably hadn't talked to people in probably 2 days prior to that. And I saw it on my calendar and I started to cancel it. And when I got to therapy, I was like, I really wanted to cancel this because I didn't want to be that patient for you. I didn't want you to have to deal with me in this moment. And my therapist said something to me that was illuminating to some of the things some patterns that I've had in my life, but also just saw some helpful modeling from what she said. She said, Reggie, you don't have to caretake for me. I have my own system and recovery and things that I do, that I put in place so that I can deal with patients who show up like you're showing up. So you don't have to caretake for me. And so when you think about that, like, she has to be there to show up for me so that I can have a full experience in that session. And then she knows no matter how high or how low it gets, she has something around that. So that's why this is so critical. Because that might have been followed up with another patient that was just as low or lower. And so she's having these back to back, but she has a process, has something. So create that for yourself so that you can then move to the next and give everyone the treatment that they deserve.
Okay, so at this time, thank you to our panelists for being here today. We're going to move forward with lunch in the cafeteria at this time.